Bobby Bone Show.
We're just going to let them do their thing, but we're here, and Dr. Luckey is here, and Amy has her earlobe completely torn in two from her earring down. She was talking with her hands, and somehow her finger caught her earring and ripped it completely out.
It's a great story.
I guess unless you're wearing a glove, though, how's it even get
Yeah.
there?
Amy, you need a pillow?
Amy, will you hold the microphone? So Amy is on the couch. Now, Dr. Luckey has set this whole place up like a doctor's office where we have trays. All of us had to get sprayed down.
There's latex gloves.
I'm in full latex right now, by the way.
Pretty cool.
Full suit from the toes all the way up. Do you guys like this?
Yeah, man, looks good.
Thank you. So,
I mean, you are a doctor.
That's true.
So it makes sense.
All the precautions are happening here. And so Dr. Luckey has a mask on. What are you doing right now, Dr. Luckey? Okay, setting up for a sterile procedure.
Okay.
Okay, Amy's laying on her back.
Okay.
The doctor is numbing her ear.
No, that's okay. Okay. Oh, okay.
What's she saying, Amy?
I don't know what's
Everybody
happening.
just chill.
Okay, I'm just breathing. Like you recommend, breathe in for 4, hold. Breathe out. Okay, square breathing, she says, is a great technique for patients.
Okay, here we go. What's the fastest you've ever done this?
That's a record.
Can you beat that record? Okay.
Amy, don't look at the size of the needle. That's a big one.
She has a needle out. The needle will be used for, it
What's-
looks like, injection.
Oh, I thought my ear was supposed to be numb because I still feel that. Yeah.
Uh-oh.
It's fine. No,
3 or
we
30?
can go. Is the needle? Could
My
the
whole
needle
hand
be
is
that
numb
bad?
right now. Her ears feel like I feel like my hand's asleep.
And that was just for fun.
Yeah.
No, it's fine. Is it going to hurt that bad? Okay, let's go.
All right, here we go. Needle is out. I'm not looking.
Yeah, it's in.
It's fine. No.
Thanks for calling 1-900.
So I think she's numbing one half, not both of them.
Not both lizard tongues?
No.
Okay. By the way, if you're just turning us on right now, Amy ripped her earring completely out of her ear so that earlobe is split into two. And Dr. Luckey is here to fix it for her.
Yeah, I don't feel this one.
Now she's the second half.
Well, I don't know. I feel.
Is she on anesthesia?
I guess I feel.
She's like one of those
I don't
kids.
feel the needle, but I felt like maybe something going inside of me stinging. Burning. What's the weirdest, case that's ever walked into your office?
I wouldn't interview her right now,
No,
Amy.
no,
I'm
that's
going to be
a HIPAA-
honest with you. I would
that's
just
a
let us
HIPAA
do this for a
violation.
second.
No, you.
No. I just wouldn't interview her right now. Let her focus on your ear.
She's working.
She's working.
But all of a
Literally.
sudden, she did put on glasses like.
She's working for you, though. That's awesome. She's working for the show.
Yeah, contract's coming up. She's trying to.
She learned that in her negotiation class.
Don't laugh. Don't
Wait,
make her laugh, guys.
Guys, don't make me move.
You're trying to interview the doctor, Amy. She's.
Okay. Shh.
Oh, she got. Is that the scalpel? It is. Yeah. Slice it.
I'm going to take your ear in. I want to make sure that you don't feel anything.
Yeah, but the problem is I hear it. Mm-hmm. Okay. Mm-hmm. Because like the sound of you.
Amy, when she talks, just turn the microphone a little toward her. That's all.
She's putting the lobes together, Buns.
She's sewing it together now?
Yeah, she's putting them together with her fingers.
Mm-hmm.
Okay, the stitches are starting to be put in.
I think it's just cutting right now.
Whatever
there's
it is, it's
cutting?
happening. It's happening.
Yeah.
Okay.
You are doing awesome.
Okay.
Eddie, what do you see now?
I think she cut to make it like a cleaner cut.
Yeah.
There's definitely some blood.
Just a little bit.
It's definitely some blood.
And then what else is happening?
She's still kind of cutting around there.
Okay. I got like 8 jokes, but I'm not going to make them because I don't want any laughing.
No, nothing funny.
Right.
But Amy can't hear her ears.
Yeah, she
now.
can. She can hear.
Oh, I see blood. I see blood. Okay.
You see it?
On her phone.
Amy, stop recording. She's got a long Q-tip.
Okay.
Yeah, she's cleaning
So
it
she's
again.
cleaning it.
Okay.
Wants to make sure it's sterile before we put the stitches in.
Hmm. Smells like sulfur.
Sorry. Indian food again. For those that have just turned us on now, listening live, Amy is getting ear reconstructive surgery. Her earring was ripped completely out. There were just 2 flaps. Every time the air conditioner would come on, you would see him. Like the guy outside the car dealership with the floaty arms. And so Dr. Luckey is sewing her ear back together.
All right. She's got the sewing kit. The stitches are about to go in right now.
Sewing kit? Is it like what you get at Hobby Lobby?
Basically, there's like string, scissors, and like a
Thread?
needle.
Amy, how you doing?
I'm doing okay.
What do you see, Amy?
Just blood. Gauze. I see gauze.
Is she sewing your ear?
Yes. Right now.
I mean, it's like sewing a sweater, dude.
Yeah.
Like, it's exactly what she's doing.
Then I did this at home ec.
Totally.
No, I don't feel it. It's just I don't feel pain. I feel tugging. That's right. And so that just freaks me out.
How you doing, Amy?
I'm good.
I think she's on the last one.
I don't know when the numbing wears off, but she just goes, if you feel anything, let me know. I'm good though. Okay,
Amy,
so we're done.
Oh.
We're done, guys.
Uh-oh.
Hey.
Does she live? Wow. Wow.
Good job, Amy.
Let's see.
How's it look?
Wow, it looks really great. Guys, just tell her.
Oh my gosh, yeah.
Wow, that's the best you've ever seen.
That's better than it started.
Oh my God. Amy's ear is now repaired. Dr. Luckey, how many stitches are in her ear right now?
About 10.
And was it worse than you thought it would be?
No.
Just ripped straight through.
There was a little bit of a flap there. There must have been that.
I don't like that word for ear.
I'm sorry.
Yeah. Ugh.
Yeah, me either. that you could tell had just been recently wounded.
Yeah.
But, otherwise, no. A typical split ear deformity.
How?
That's a technical term, guys.
Yes.
Yeah, I
Yes.
mean, great.
Amy, how do you feel?
I feel fine. I'm just a little shaky, but she said that's from the epinephrine.
Mm.
In the local anesthetic, it has a tendency to make your heart beat a little bit quickly.
Mhm.
So that's
Can I have some of
why
that?
I wanted her to stay
So
fine.
we're good. Amy, you feel good?
Mm-hmm.
Dr. Luckey, her ear's going to heal back?
It will. In 7 to 10 days, we'll take the sutures out. And then in about 6 weeks, we can re-pierce that area.
So when you called in yesterday, you said there was a 50-50 chance of an infection.
Yes. So whenever you have a wound, whether it's a laceration or something that has opened up spontaneously on its own, it has a potential for getting colonized with the bacteria from your skin. So if you are to secondarily close that, generally speaking, we say within 24 hours, it still has a pretty reasonable chance of healing without an infection. But beyond that, sometimes it does have a risk for infection. But it looked near healed this morning.
Not a girl, Amy. You've been taking care of it. Good job.
Perfect. Yeah.
Okay, a couple questions I have. And by the way, please say the name of your business one more time.
Female Plastic Surgery Associates.
Female Plastic Surgery Associates. Now, can I go if I'm not a female?
Yes, absolutely. We have a lot of male surgeons or plastic surgery candidates.
And so what would you do to me, though? If you saw me walk in and I'm like, just give me something. I need it, doc. What would you do to me?
Absolutely nothing.
Oh.
Wow.
Am I
You're
perfect?
perfect.
Okay, let's just say this. Let's say, guys, it seems that me and my male friends, we got a little extra on our stomachs. And let's say it's like if you pinched it like this much. How long would I be out before I could be like running and lifting again if you took that much off with, what do you do, liposuction?
Liposuction?
Yeah.
Well, patients are usually out for about 2 weeks. There's some bruising and some swelling that accompanies that surgery. But as long as you keep the compression in place, most patients are back to a normal existence in about 2 weeks.
What's the most fun surgery you do?
I love eyelids. Yeah.
What do people do to their eyelids?
Well, as we age, we all start getting like a little bit of heaviness to our upper lids. and the skin kind of hangs. And it can actually occlude your vision eventually as you get older. And so taking that rim of skin off from above your eyelid just opens up your eye, makes it look more youthful.
Dang.
Isn't that scary, though, because it's so close to the eye?
No, you're not actually in the eye. It's just the skin around the eye.
What's the most popular thing you see people coming in for lately?
Breast dogs.
Okay.
A breast dog, which, by
Yeah.
the way, in case you guys are wondering, that's a butt lift.
Breast?
No, I'm just kidding. It's a breast augmentation. I'm just kidding.
What about a butt lift? Like
Yeah, like
Brazilian butt lifts. We
Yeah.
were talking about those not too long
Why
ago.
is it
on the
Brazilian,
show.
by the way? Is it
Yeah.
one for every country?
No.
Oh.
I think it's just a general term to include fat grafting to your buttocks area, just to make it look a little bit more plentiful.
What about pec implants? Could you do that?
Back in
For
place-
me.
Yeah, absolutely. Very similar to breast aug, but just for men. But I don't know that you need it.
Okay. What about calf implants?
Ooh, yes, that's very similar. Similar in terms of the implants, just the location that's different from a breast aug.
So, do you have an Instagram that we can tell our people to go
Absolutely.
follow? What is it?
Dr. Natasha Luckey.
Dr.
Luckey.
Natasha Luckey, Luckey. That's so cool that that's your last name.
Thank you.
She got lucky.
Lucky.
I got
She
lucky.
got
Okay,
Yeah,
all right.
so cool.
Amy got lucky.
I got lucky with Dr. Lucky.
Amy, do you feel good? Amy, you feel good?
Yeah, I feel good.
I don't know.
Yeah.
Like extra good?
I feel good.
Okay.
No.
Dr. Luckey, we thank you 10,000 times. And what we'd love to do in a month or so or whatever, you should come up here and just do a segment with us because we have so many questions about this type of thing.
Oh, I would
how
love it.
can be, how people can use it for, like you were talking about, cancer patients, or if I'm just like, I want to get a better chin. You know, all of that we're super curious about.
Absolutely.
Oh, I got a question. Do you do leg lengthening surgeries? Because Ray's kind of short. If we send him to you, could you do that?
Is that
Hey,
plastic?
Are you making fun of him?
No.
Okay. Phew.
You don't do leg
I
lengthening,
have
do
a
you?
short leg. I was just making sure. No, that's ortho. You definitely want to go to a qualified orthopedic surgeon for that.
Okay.
Yeah, don't be mean, Lunchbox. Do you have one you recommend to Ray? No, I'm just kidding. I'm just kidding.
Ray is
Don't put me on the
perfect.
spot.
Just
He's
the way
perfect.
he
I know.
is.
He's 5'6". I love that about him. Okay. Dr. Luckey, thank you. Amy,
Thank you.
Thank you.
do you feel good?
And
Thanks.
assistant. Thank you,
Oh,
assistant.
yes.
Addison Taylor.
Addison.
Kidwell, sorry.
Addison, she cleaned that whole place up. She had
It's
trays,
amazing.
Yeah.
and forklifts. Everything was in here, just in case.
Yeah, I feel like I was in really good hands. So thank y'all for making that so easy and painless. So it's good.
All right, there she is, Dr. Luckey, and there's Amy's beautiful new ear. Wow. All right, back in a minute.